Welcome back to Local Matters on KTLO. We're visiting with Dr. Winmore of the Baxter Regional Bone and Joint Clinic. Mississippi boy, right? Grew up in Mississippi?
Yes.
Spent time in Louisiana, kind of all over the SEC, per se. SEC West, I should say.
Yes, the West.
The West. How do you explain our hospital when you go back and see other colleagues? You know, we're locals here, so we're quite proud of our hospital.
It is probably the most unusual situation that I've ever seen. I've practiced in towns that were this size. For example, my hometown hospital is 1/10 the size of this one. And of course, I've practiced in hospitals in towns that were much bigger. It's almost shocking to come here and drive around and then drive up to the hospital and say, wow, it's amazing. So I think you have to look at it's a very unusual situation in that we're located in a kind of a void that needed to be filled. You got Harrison, to the west, and you got Salem. Those hospitals are very small. Then you basically go to Springfield. So the service area is huge. And then I think you take the planning of the physicians and administrators over the last 30 years has built a tremendous facility that I think that I have patients come in all the time and say, I ask them, how did you get here? From Chicago. Well, we were looking for a place to get out of Chicago, and we first looked at Cherokee Village, but then we came to Mountain Home, we saw the hospital, we saw the facility. We wanted to be close to a hospital, so they stopped here.
So
it's impressive.
Always good to hear. We're quite proud of Baxter Regional Medical Center, and also you're quite proud of your clinic. How many staff members are at the clinic now?
Don't ask me that question. I have. Let's see. Yeah,
too many to count.
Do I have to count them? Let's say one. No, because if I miss one, I say 1, 2, 3, 4, 5, 6.
We need 8. The Jeopardy
theme
song
if you
going in
don't
the
count physical therapy, which really are not my employees. They're their own group out there. But in the building, let's say 8 to 10.
Yeah. Well, what I was getting at though is if someone comes in and you replace their hip or knee, everything happens at your clinic.
9. I missed
1. he's still counting in his head. But your therapists are there at your clinic. I mean, everything happens there at the clinic, and you have continuity. You get to see the same people over and over.
Yes, that's a great thing, too. And I will put a pitch in for my competitor, because I always do. They also have their own physical therapy, and it is great for the patient because it allows you – and again, I don't own that physical therapy. That is not mine. That is a hospital organization. So
they're hospital employees.
Right. They happen to be in the same building. But what's great is if they have a problem, they walk over and say, hey, I've got a problem. What do we do? So there's not this lag time in hearing, I get a letter back 2 days later explaining the problem when they'll walk over and get me. So it's great. Plus it's, let's think, the satellite clinics are a little easier to get into than the hospital because of the size of the hospital.
Volume, yeah.
So they drive in. It's easy to get into the therapy department. So we're very fortunate to have that on site.
Let's talk a little bit about osteoporosis. I mean, again, we live in a retirement community. You hear about it some, and then you don't hear about it very much. Is it a real problem to our seniors?
It is a big problem. It is probably one of the most overlooked problems. Yeah,
how much of it goes untreated?
Oh, I can't even imagine the actual numbers, but we got involved in treating osteoporosis through the orthopedic aspect of patients that had bad fractures, and you look at that fracture, you look at their bone and say, wow, they've got really poor bone. So the American Academy several years ago started really pushing us to treat this because some of these fractures would not have happened if they didn't have bad osteoporosis. So we've moved into treating our fracture patients that have not already been on treatment. And a great deal of primary care treat osteoporosis. But there's so many patients out there that either don't have a primary physician or are young enough that they don't really fall into the category that should be osteoporotic, but they are. So it's a big, big problem. And it's a problem the treatment is really evolving. I mean, it's not like we have a great treatment that's guaranteed to fix the problem. But we do have things that we know will slow down the process and in some cases will improve their their bone density. But it's a bad problem. And unfortunately, many patients, we find it out too late. They already have multiple spine compression fractures. They've broken a hip. They're very kyphotic. They bend over because their back is compressed. And you're really behind the 8 ball when you get to that.
What's the first thing we need to do? Take a bone density test?
Well, I think if you read, the recommendations are, there's an age that you should start thinking about it. There's lots of other, we put osteoporosis into different categories. You can have medication-induced osteoporosis. Steroids will do that. You have hormone or lack thereof induced osteoporosis, which means postmenopausal women tend to start losing their bone stock. Actually, we all start losing bone stock in the mid-30s. We've built all we're going to build. Mm-hmm. So it's always good to have.
We start to sit down a little bit more.
and it's great to have a great bone stock. It's like filling the bank up with money early in life because it's going to start leaching out, kind of like having children. It just leaches out. So basically, I hope my kids will hear that. Yeah. Maybe I should hope they hear that. But there's certain, if you're on certain medications, and in most cases, if you're on certain medications, the physician treating you is going to be on the lookout for that. Mm-hmm. But just the natural, our patients are living many into their 90s and older, so it's a natural progression to lose bone, mineral content. So it's one of those things, weight-bearing exercises, being as active as you can be. We always push calcium and vitamin D, and that's great, but there are certain situations where you can't assimilate that.
Can't replicate.
If you don't have the hormones to do that, it may not work. So that's when you get into the treatments, the medications. So really, I think everybody, I hope that we're moving towards all physicians screening and asking the right questions to prevent some of the problems that we're seeing.
Is there a symptom or a sign that arises, or is it just?
It's generally, in our case, it's mostly a fracture. Mm-hmm. And those that don't fall
and then it's too late.
Come to us with, well, it's too late to help that fracture. Yeah. To prevent that fracture. There's a group of medications that will actually help, at least theoretically, help rebuild bone. See, most of them don't really help you rebuild bone. They stop the process of losing bone. Mm-hmm. A few will actually help you rebuild bone. So we use that group of medicines on patients that have a fracture, trying to help heal that and then try to rebuild them to some level. In most cases, what we see is we stabilize their loss.
If someone's listening and they're worried about this and they're like, well, I don't know if this affects me, if this applies to me.
Ask your primary care physician. They all are very knowledgeable about it. Mm-hmm. Almost most of the clinics around here have the simple X-ray exam that tests for it. It's just a matter of them being aware that you're concerned about it. And if you're 25 years old, they're going to say, don't worry about it. And they should. Mm-hmm. But when we move into that group that are at risk, which, again, I won't go through the whole because it's a huge screening process, they'll look at it and say, yeah, you're in a group that we probably should test.
I think for the females listening, the MMU, the Mobile Mammography Unit at Baxter Regional Medical Center, I think they give a bone density test as part of their mammograms when you visit the MMU.
See, now you're telling me something I don't know.
See, there you
go. Because I don't follow the Mobile Mammography Unit.
You're not on the MMU
No, I don't know that. But if they do, that is wonderful. Absolutely wonderful.
Let's take a break. You're listening to Local Matters, KTLO.